I'm a cardiologist. I want to tell you about this story of life and death. And just before you sit back, half of you will die of cardiovascular disease. Okay, so that should focus your minds. Now, although I've worked in London for 30 years, as you can tell, I'm Scottish. We consider our birthright to die of heart disease. Our grandparents did, our parents did, and we're disappointed if it doesn't happen to us. Now, that's not true, actually. Don't quote me on that. And I'm going to share with you some of the developments we're doing to try and make this not happen, so future generations have lower risk. But it's a real challenge. This is still the world's biggest killer. Now, how many of you know where your heart is? How many of you think it's in the center of your chest? You'd be wrong. It's on the left-hand side, okay? It's not in the center. It's on the left-hand side. It's about the size of your fist, just slightly larger in health, and it pumps 70 times a minute, 100,000 times per day from many weeks before you're born to the second you die. Pretty impressive. But you've all heard about the heart. I'd like to talk to you a little bit more about how it's connected to the vascular system, which is this very clever system of pipes that take blood back to the heart and then distribute it to getting oxygen and nutrients round to every single cell. Now, if you were to take all of those pipes and line them up, it'd be 100,000 kilometers in each of you. So 2 or 3 times around the world in terms of this system of pipes. So I'm now going to show you a very short video, which is us coursing down a typical artery, just to show you what it looks like, he says confidently. So let's just play this. You should see the red and white cells going down this artery. It's a beautiful lining there with little branches coming off. And this is the organ that pumps the blood through that. This is the heart itself. So that's what's happening in health. But obviously, as time goes on, this system becomes not so healthy. And I'm just looking around the room. I can actually identify who's already furring up, okay? And some of you are furring up like a kettle. Can I tell you that? If you're male, if you're older, you will have some furring up going on. And it happens even from childhood onwards. And what we're trying to do is understand that process, try to slow it down, because it's something that damages and causes major things. So I'm now going to show you a journey through a blood vessel where it's actually got furring up. You'll see this big lump of cholesterol. It's got a little cap over the top most of the time, but at times it ruptures. And when it ruptures, it causes a clot to form, and that can block the artery and cause things like heart attack or stroke or gangrene and the need for amputation. So it's kind of pretty serious business. Let me just show you the video. So here's a big furred up plaque here that many of you are sitting with in the audience. Hopefully it's not rupturing at the moment. And then you can see the clot forming on top, which will then block that artery and stop the blood getting down. And you can see here part of the heart muscle dying because it's not getting its blood supply. Not so great. We don't want that to happen. Actually, I gave a TED talk at the Royal Festival Hall last year, and somebody actually collapsed at this point. This is true. People thought it was staged. It wasn't, and I had to run off the stage and resuscitate somebody and come back to finish it. Thankfully, nobody seems to be doing that today. Right, this is the quiz part of it all. What do you think speeds up the furred up process? And you know, this used to be just a problem of the rich parts of the world. But it's now the whole world. It's a global epidemic. And right across the world, this is the most common reason. Why do your arteries fur up? Give me some ideas. Fries, yes. So let's just see what's coming over the horizon just to remind us what happens. Yes, fast food, high saturated fat really helps speed up the furring up process. Readily available across the world. Cigarettes, the worst possible thing for arteries. So there's nothing else you do. Persuade somebody to stop smoking. Huge health benefits. Screen time, sedentary, sitting for too long without any activity, not so great for your arteries. Daily Mail covered an article today about the risk of being sedentary. So those are the lifestyle factors that you can educate yourself about, your children, your families, to try and prevent heart attack and stroke. It's your own vascular health. Invest in your own future of your arteries. But I also want to give you a kind of good news story. You know, health and lifestyle, it's all very challenging. We're getting fatter, there's more diabetes, there's all of these issues that we're struggling to control. But the life sciences industry, working in big clinical trials with patients, with doctors, with regulators, reimbursement authorities, are trying to find new ways to reduce the risk of things happening. So even if your arteries fur up, can we stop the rupture of those plaques? Can we stop clot forming? Can we stop the heart attacks and the strokes? So even although the furring up process is there, can we make it more stable? So I just want to show you this picture and focus on the little blue dots. They're not actually blue in reality, but it's just a visualization. And this is us repurposing an old medication. So this is an anticoagulant, a blood thinner, which we use if you get a clot in your leg or a clot in your lung. But here we've found that one of the modern generation ones, at a very small dose, when you give it to people that have furring up, it reduces the risk of stroke, reduces the risk of heart attack, and makes you less likely to die from cardiovascular problems. And how it works, we think, the plaque is ruptured, all of this is trying to stick to the top of it and block it. The anticoagulant goes in there and stops the clot forming, stops it getting larger, stops it blocking the artery. So even although the plaque ruptures, it's allowed time to heal without causing a heart attack or a stroke. So that's really clever and intelligent use, repurposing of old medications. But there's endless examples, and I don't have time because I've got a very short talk. But a new group of diabetes drugs, yes, they control blood sugar and get that much tighter, but actually we've found out it makes a huge difference to the way the heart pumps and protects you from heart failure. So lots of work going on, from big data, from discovery of molecules, from doing clinical trials more quickly, more intelligently, more digitally, have really helped us come up with new solutions. But just before I finish, I'd like to reflect on how this influences me as a physician, as a cardiologist, but also our healthcare system. NHS. How many of you have used the NHS? Yeah. Set up over 70 years ago, 5th of July 1948. Any of you know the person in the middle there, the gentleman standing there? Nye Bevan. Well done. Aneurin Bevan. He was a health minister that really pushed the National Health Service to be formed. And this was a little document that was given to everybody at that time. And I'm just going to read it out for you. This is your new National Health Service. What is it? How do you get it? It will provide you with all medical, dental, and nursing care. Everyone, rich or poor, man, woman, or child, can use it, or any part of it. There are no charges, except for a few special items. No insurance qualifications. But it's not a charity. You're all paying for it, mainly as taxpayers, and it will relieve your money worries in time of illness. It's really hard nowadays to realize how important and how different that was for people that were really concerned that if they didn't have money, they wouldn't get health care. Now this, do you know who this person is on the bed? Any of you know? You get top prize if you do. Her name is Silvia Diggory. She's the first ever patient in the National Health Service, and she became a lifelong champion for the health service, and her grandson is actually a junior doctor in the Midlands. So she was there. This is Park Hospital in Manchester, first ever patient in the NHS. I've also put up where they used to live. It's just around the corner from where I live, and I walk past this blue plaque. And the reason I'm saying that is his wife was Jenny Lee, or Baroness Lee, who set up the Open University. So one person in the couple set up the NHS, the other person set up the Open University. This is the original power couple of the 1940s. Yep, amazing people. But I'm just going to finish with this. This is about, I think, where you're going with Wired, with innovation, with technology, because the world's health needs have changed. When the NHS was set up in 1948, look at what the situation was in the UK. Half of us died by the age of 65. Very few of us got to enjoy a long retirement. And if you had a health problem, it tended to be an acute problem. If you could treat that, you were fine. Tended to be just one issue. 70 years on, nowadays, totally different situation. It's not just the UK, it's any developed world country. Only 14% of us, thankfully, die before 65. You can see the life expectancy there, a huge change in a short space of time. But if you actually are lucky enough to get into old age and very old age, you will be living with multiple chronic conditions. How do we deliver healthcare? How do we structure that? Where does technology fit in? Thank you very much.